Welcome, everybody. I'm going to be talking about improving bowel disease with cannabidiol today. And I want to talk about some of the symptoms and some of the pathways that are involved with these common gastrointestinal disorders. Now, many of these disorders are a collection and a family that I will be addressing as a whole. For the most part, we're going to be addressing intestinal disorders that belong to the large intestines and the small intestines. So what we're going to cover today is we're going to talk about the chronic gastrointestinal disorders and the burden of disease. I want to give you an idea of what's going on overall and how important this problem is. And then I want to talk about some of the problem pathways that are thought to be involved with the disease. Conventional treatment, I'll just mention a few words about it, and then we'll talk about CBD and how CBD will have some targeted action on these gut disorders that can make immeasurable improvements. Now, CBD, I'll have CBD recommendations and results. Now, one of the reasons I want to talk about the gastrointestinal diseases is because this is one of the areas where cannabidiol really shines. The dramatic results and improvements and resolutions of this problem are just really profound for people who are really desperate to find a solution for their difficulties and their suffering. Now, in this collection, I'm really going to be talking about inflammatory bowel disease, irritable bowel syndrome, and the intestinal permeability disorders that we commonly call leaky gut. We're going to focus on these areas because these are reasonably defined, and I think that is the areas that most of our patients understand. One of the points that I want to make here is that this is a spectrum of disorders in terms of defining does somebody have this problem or that problem. Certainly the inflammatory bowel disease, that's pretty clear, biopsy, looking at it, but there's all sorts of blends of these particular problems. What exactly is it? How do you treat those individual problems? What I've seen is that for most part, you don't have to differentiate a great deal. The cannabidiol is effective for all of these disorders, maybe some fluctuations in the dose. Cannabidiol will be effective for all of these syndromes. So it's a matter of convincing patients to get on it using those ancillary treatments that you have in place, because cannabidiol may not necessarily be the only thing that needs to be taken care of. There may be some eating habits and some other issues that need to be taken care of as well. Now, if we're talking about the burden of disease, we're really talking about a huge amount. So when we're talking and when we're discussing inflammatory bowel disease, we've got about 1.3 million people in this country, but at least $31 billion is spent on a yearly basis for this condition. And a lot of that entails some of the medications and the surgeries. Now, if we're talking about the syndrome, the irritable bowel syndromes, 20% of the population has irritable bowel syndromes of some form or another, and we're talking at least $8 billion. But I think that really underplays its significance because this is a much bigger problem and people are affected, and it's one of the most common reasons why patients go to the doctor because of irritable bowel syndrome. So this could have a big impact on people's work time, their ability to function, as well as even chronic disability, impairment, medical costs. And one of the big focuses, especially for inflammatory bowel disease, is the unnecessary surgery and procedures that are entailed as a result of it. It turns out that with Crohn's disease, 70% of patients end up with surgery, removing their colon after 30 years of this disease. I mean, that's a terrible, terrible problem. And what I've seen more recently is that children, kids in their teens, being recommended to have their colon removed as a result of these impairments early on. So it's tragic that people would have to go through this kind of suffering needlessly. Now, I want to go back to the endocannabinoid system because what we're seeing with gastrointestinal diseases is a huge overlap. Endocannabinoid dysfunction is very common across the board in all kinds of chronic diseases, but especially in syndromes and complexes like inflammatory bowel disease. We're also in terms of what causes the dysfunction in the endocannabinoid system. It can be diet, it can be toxins, it can be lifestyle, whatever the problem is. What we're ending up with are people who are impaired, at least fundamentally, on the endocrine and with neuromuscular junctions at the endocannabinoid system level, so that leads to some of the other dysfunctions that we see in immune function within the gut and within the nerves and the functioning there. Now, CBD can help restore the endocannabinoid system, as with other therapies like the diet, exercise, and sleep. They're all very important for the restoration. But I want you to look at these problems fundamentally from the endocannabinoid system, because this seems to be the root cause for many of the problems that we're encountering. Otherwise, we don't really have a cause for irritable bowel, for inflammatory bowel. That the actual origins of those have not been determined. Now, if we're looking at the pathways of disease, we're not looking at the causes, because we really don't know, and there's a lot of speculation about different problems, whether it's infections or it's food or it's genetics, whatever that may be. What we're seeing, of course, as mentioned before, is endocannabinoid system dysfunction, and that may be it may be a reflection of what's going on behind the thing. Behind the disease and what's being manifest. But we're seeing inflammation. We're seeing immune dysfunction. And what I mean by that is that there's a high population of immune cells, of macrophages in the area of the gut that is leading to an outpouring of cytokines and inflammatory substances that are leading to many of these effects that are happening in the gut. And those effects typically are muscular irritability, so you're getting muscle spasms, you're getting pain, and a great deal of dysfunction there. You're getting permeability issues, where you're getting proteins that are in the gut are transmitting into through the capillaries and bypassing the tight junctions between endothelial cells and getting right into the system to give allergic-like symptoms that people manifest. So that some foods, they manifest allergic foods. Why do these happen? And that part of that could be permeability issues. There's also pain signals. You know, the gut has more neurotransmitters than the brain in terms of substances, and that goes for connections for nerve transmitters or nerve synapses. The gut is a very complicated area, and some people call that the real brain of the body in terms of how that functions. These pain signals can be absolutely terrible. In irritable bowel syndrome, what's been discovered is that they have an increased sensitivity. So there is a hyper response to what seems to be normal peristaltic activity, and normal muscle contractions are highly painful in individuals with irritable bowel syndrome. In addition, we've got the microbiome that is there, the bacteria that do a lot of the processing for many of the foods that are there. This system, when it becomes imbalanced, is also leading to some of the pathways of disease. An example is the microbiomes in the distal colon actually produce a number of short-chain fatty acids that are therapeutic, and the butyrate that is quite effective for nourishing the colonocytes that line the colon and help it to resist type of problems, inflammation, and inflammatory signals. So all of these systems are dysfunctional or working, or just part of them, leading to some of the suffering that goes on with all of these gastrointestinal disorders. Now let's take a look at cannabidiol. And you've seen this kind of stuff before, realizing that cannabidiol that I'm talking about is from cannabis, but there are two main types of cannabis, and I just separate that simply into marijuana and hemp. And CBD is coming from the hemp side, and it improves health. It doesn't cause any high. There's no psychoactive effect to it. It's safe, it's legal, it's effective, and there's no significant adverse reactions, toxicity, or interaction. So when we're looking at cannabidiol and its effect on the gastrointestinal tract, this is, I find, quite phenomenal, where you have got cannabidiol modulating the immune reactivity of the gut. That means it's decreasing the populations of the macrophages that are producing the cytokines. So it's reducing the number of cells, the inflammatory cells that are there, and the recruitment of other cells that exacerbate the problem. Of course, you've got the anti-inflammatory effect. When you've got the macrophages reduced, you're also controlling their output so that they're reducing all of the cytokines, in particular the tumor necrosis factor, for which standard and in current medical practice uses very highly and strongly as that injectable drug costing about $1,000 an injection, upwards of $4,000 per month. A huge, huge expense, and it's not without adverse effects, and only 30% of people really respond to that. In addition, you've got cannabidiol working on relaxing the vasculature of the gut. So you're getting better blood flow, you're getting better function of the gut, you're getting better performance. Not only that, you've got analgesia. You're reducing the pain sensitivity. Remember, I was talking about inflammatory bowel disease having extra sensory perceptions that are there that cause an increased feeling of pain for what should be normal peristaltic or normal action going on within the gut. Cannabidiol is working on the smooth muscle. It's relaxing it. It's allowing it to function normally. Now, this is very interesting. What we're finding with cannabidiol is that it tightens, it reconnects those tight junctions and helps restore those, and it restores and prevents the increased permeability that we're seeing in these disease states. Not only that, we have evidence that cannabidiol is modulating the microbiome environment. So it's changing the bacteria that are there and shifting them in one direction or another, and typically that's for health. In fact, I call cannabidiol the Boy Scout of all molecules because it always does the right thing. It's always taking the right action, much like what is termed an adaptogen, making the right changes in the right place, in the right tissue. Now, not only does cannabidiol work on those tissues in general, but it's working on a cellular level and even at an epigenetic level as well. We know that cannabidiol is interacting with the cell nucleus at the PPAR gamma receptors, which have a major role in determining what enzymes are being produced. We actually have evidence for cannabinoid receptors that are located on the mitochondrial membrane, and cannabidiol is having effects on those mitochondria and reprogramming them for better function. In addition, cannabidiol on a cellular level is preserving the glutathione, and it regulates the DNA methylation that's going on in the nucleus. So a host of factors on a cellular level. And I think that's another very key point, is that we're seeing different effects from the endocannabinoid system and CBD on different cell types in different tissues. It matters a great deal what tissue we're talking about. For instance, in cancer, we're seeing an effect of destroying cancer, of increasing the death of cancer cells while we're preserving healthy tissue from the ravages of chemo and radiation therapy. A marvelous and intelligent molecule that's working on the body and protecting it, as well as enhancing a normal recovery and return to homeostasis and elimination of those cells that we don't want to have around. Because cannabidiol is safe and effective, there's no need to, everybody can start with about 15 milligrams, using it twice daily, and then make adjustments early and boldly to control the symptoms. So what we're talking about is within the first day or 2 days, you want to increase the dose, maybe a doubling of the dose. We don't see the side effects from it. So find the dose that works and get people into relief, get them moving along. When you start to see them improving, showing some of the side benefits that come with cannabidiol, that's the time to realize that the cannabidiol is working and for the patient to know that this therapy is a valid approach. There's several different forms of cannabidiol, and you can pick the one that most matches with the individual preference. Duration of action, a lot of variability. Target dose for inflammatory bowel disease, I typically see about 60 milligrams per day in a divided dose is what is generally effective. Maybe a little bit more, and maybe a little bit less, But many times after resolution, which typically takes about 3 weeks, once they've resolved, you can decrease that dose, get it back down to normal, lower levels that are much more affordable and allow people to prevent these types of episodes in the future by using a continuing maintenance dose. Clinically, about 4 weeks, 3 to 4 weeks, you get resolution, and you're able to decrease the dose quite a bit. Now, who should be using the cannabidiol? Certainly, if you've tried the regular therapies or if you want to avoid medications, this is a great way to go. Any age group is fine. There's no particular exclusion for anybody or anything. You should be looking at patients for CBD who have impaired organ function, who have multiple other problems that are going on that could really benefit from those special benefits that cannabidiol offers. And I just mentioned that there are other problems that cannabidiol is also helpful for. And these include the neurologic system, the immune function all over, especially autoimmune diseases, adrenal functions and controls. So you've got a broad range of effects that cannabidiol can play an important part in. So let me recap this. So we're talking about all of the gastrointestinal disorders. These are very common, and they're high cost and with a great deal of suffering and disability. That endocannabinoid deficiency is common, and the CBD is going to help restore the endocannabinoid system, along with those other good health programs that you apply in your practice. CBD addresses all of the pathways of gastrointestinal disorders. And so you've got a great support system that's going to protect the gut and improve the function in all areas and relieve the symptoms at the same time. Now, CBD is supported in plenty of preclinical studies and in practice. I know my experience over the last 3 years has really been quite spectacular in terms of the relief, especially of inflammatory bowel disease. Absolutely life-transforming for many people. And the dosing is modest with fast results. There's very little reason to avoid using cannabidiol, and I think that it really should be considered first-line therapy. So I'm going to open it up to questions, but I do have some links here that could be valuable for you. Some of the references and a short article that I wrote about inflammatory bowel disease, as well as an overview of cannabidiol specifically. And the slides for this presentation are available at this link. Well, I'd like to get some suggestions from you about topics to cover in the next presentation. This, of course, is being recorded, and we'll get this posted, go onto the Elixinol website and give you access to learning about this and sharing it with your clients, as well as educating yourself and reminding yourself about some of the things that I've spoken of. It's been a real pleasure to talking with you, and I dearly enjoy being able to address these particular problems and bring the clinicians up to speed on these serious problems and how cannabidiol can make a world of difference and really transform people's lives. Great to talk with you. Thank you very much for attending, and I look forward to seeing you here next week.